Hello, this is Dr. Stanley Lang. Welcome to this broadcast, and the topic is on type 1.5 diabetes. And so if you've been following any videos on diabetes, you know that usually we talk about type 1 or type 2 diabetes. Used to be called juvenile diabetes versus adult onset diabetes, but because many younger people are now getting type 2 diabetes, we don't use the term juvenile versus adult anymore. So typically type 1 diabetes is when somebody becomes severely insulin deficient. It usually happens very rapidly, and the person needs insulin very quickly or they will die. They go into a condition that's called ketoacidosis. This is not the usual diabetes that adults experience. The other type of diabetes, called type 2 diabetes, or the other common type, is where the body becomes gradually resistant to its own insulin. And this happens over many, usually decades. And so the person's blood sugar climbs, not because they're deficient in insulin, but because they are having insulin that just doesn't work right because the insulin receptors are not responding to the increasing levels of insulin. And eventually, the body reaches a maximum of what it can do to respond to the sort of maxed out insulin signal. And then gradually the insulin starts to drop off a little bit because the pancreas just basically maxes out its ability to produce insulin. So we've explained that in a lot of different places. So what is this type 1.5 diabetes? Well, the reason I wanted to talk about it is I had a new patient recently with this diagnosis. And I have had a few patients over the years with this, and I have a slightly different take on what to do about it. So I wanted to share that take on with you. This so-called type 1.5 has a longer, fancier term now that is designated as an autoimmune condition of the pancreas because it appears that what's happening is the pancreas slowly loses the ability to make enough insulin for the body to maintain its ability to control blood sugars. The thing is, for the majority of the people, at least that I've ever seen, it actually has just enough insulin to get by, but only if you follow the right lifestyle. So what happens with type 1.5 diabetes is that some autoimmune process happens or some immune-related process happens and antibodies attack the pancreas, and there's just not quite enough insulin there for reserve. So when people eat higher glycemic foods, there's not enough to push out extra insulin to keep the blood sugar in control. But as it turns out, at least for every patient that I've had over the years, and I've had patients for now multiple decades who fall into this category, if we keep them in a very low glycemic diet, they control their blood sugar and they don't progress. So I do think that there's a significant environmental component to this autoimmune process, which is that if you avoid overstressing the pancreas by making it push out more insulin than it's capable of doing, if you avoid doing that, then the pancreas sort of maintains its ability to keep just enough insulin going on to not progress to what may happen, which is to become full-fledged type 1 diabetics. Now, the only person that I've had that went on from this 1.5 to type 1 state was somebody that flagrantly disregarded everything that I said about the diet. Everybody else who's been in this type 1.5 in-between state has maintained normal blood sugars or reasonably good control of their diabetes. They would be considered an excellent control, and they've maintained in some cases for decades. So I do think that in many cases, perhaps most of the time, the person in this in-between state can be controlled by a very low glycemic diet. Now, the lowest glycemic diet is a ketogenic diet, but even the version that I teach people, the modified plate low glycemic diet, seems to work quite well for people who will follow it. And one of the things that's really critical about this type 1.5 diabetes is that you have to critically avoid the usual oral medicines that are given for type 2 diabetes, because they will flog the pancreas and make it work harder than it's supposed to, and it will wear it out. It will burn it out. So people will get sick on who have this type 1.5 in between diabetes if they're given oral medicine. The only treatment that they should get, if they get any treatment at all at the beginning, is to use insulin while they start to achieve a very low glycemic diet. And if they do that very carefully, they may recover the ability to completely control themselves without the additional insulin. So not too many of you who are diabetics or have diabetic family members are in this situation, but a few are, and it's important to be aware of it. And especially if you've got family histories of diabetes, you're more likely to have this 1.5 situation. There's definitely some sort of a genetic process that's part of it, of this autoimmune predisposition. So I want to encourage people who have this situation that if you eat a very good, very low glycemic diet, you have a good chance of controlling your blood sugar, if not forever, for at least many, many years. And as I said, in all of the patients that I've had who followed the diet rigorously, they so far have maintained either normal blood sugars or only slightly elevated blood sugars, would be considered in excellent control as a diabetic. So I hope this is helpful to you. I wish you well. God bless. Have a good day.